Good afternoon and welcome to another webinar. My name is Dr. Ken Stewart, and today's topic is entitled Giving Thanks During a Pandemic. For most of us, if not all of us, this is our first experience celebrating Thanksgiving during a pandemic. So let's jump right in. The first day of fall came and went on September 22nd, which means people across the country are beginning to plan their Thanksgiving festivities. With the COVID-19 pandemic still ongoing, the Centers for Disease Control and Prevention want Americans to keep coronavirus risk in mind. Specifically, they want people to know that traveling for the holidays increases your chance of contracting or spreading the coronavirus. However, we don't have to wait until Thanksgiving to give thanks. We can give thanks right now. During this webinar, I'm going to present five reasons why giving thanks is good for your health, and then the risk of various activities as we prepare for Thanksgiving Day. Often held at harvest time, celebrations like these have been part of cultures throughout history. For example, the ancient Romans celebrated Cerealia, a harvest festival that honored Ceres, the goddess of corn, while ancient Greek women held one known as Thesmosphoria, honoring Demeter, the goddess of grain. Chuseok is the autumn festival in Korea, I hope I'm pronouncing that correctly, a national celebration where people return to their hometowns to remember their ancestors, give thanks for the year's blessings, and dine on traditional foods. The human need to express gratitude seems to be a powerful and almost universal phenomenon. But why? Well, Dr. Robert Emmons, one of the pioneers of research into the ways that gratitude affects our lives, assessed people's levels of thankfulness. The results of his studies and others, both psychological and physiological, are fascinating. Here are 5 reasons why giving thanks is good for you. Research shows that grateful people had less depression and stress, lowered blood pressure, more energy, and greater optimism. In older adults, Emmons and a colleague found that a daily practice of gratitude even slowed down some of the effects of neurodegeneration that often occurs as we age. Cortisol is often called the stress hormone, and when our body produces too much, it can deplete the immune system and raise blood sugar levels. A study conducted at the Institute of Heart Math Research Center in California found that positive emotions like appreciation significantly lowered levels of cortisol. Research by U.S. psychologists Sarah Algo and Baldwin Way indicated that gratitude can lead to better relationships. The explanation may be connected to increased production of oxytocin, sometimes called the bonding hormone, because it fosters calm and security in relationships. And then number 5, people with high blood pressure who actively express thankfulness can achieve up to a 10% reduction in systolic blood pressure and decrease their dietary fat intake by up to 20%. With Thanksgiving and other food center holidays coming up, that's a potential benefit to be grateful for all year round. Thanksgiving is a time when many families travel long distances to celebrate and give thanks. However, the CDC says staying home is the best way to protect yourself and others. But if you must travel, health officials want you to be informed of the risks involved. So as you prepare, consider the risks. Low risk activities can be having a small dinner with other people who live in your household, preparing traditional family recipes for family and neighbors, especially those at high risk of severe illness from COVID-19, and delivering them in a way that doesn't involve contact with others, having a virtual dinner and sharing recipes with friends and family, shopping online rather than in person on the day after Thanksgiving or the next day, and watching sport events, parades, and movies from your home. So these are low risk activities. Now we have moderate risk activities. If you're going to host a Thanksgiving dinner, organize an outdoor event with family and friends from your neighborhood, visiting pumpkin patches or orchards where people use hand sanitizer before touching pumpkins or picking apples. Wearing a mask is encouraged or enforced, and people are able to maintain social distancing. And lastly, attending a small outdoor sports event with safety precautions in place. These are moderate risk activities. Now we end off with high risk activities. These events should be avoided to help prevent the spread of the virus. Going shopping in crowded stores just before or after Thanksgiving, participating or being a spectator at a crowded race, attending crowded parades, using alcohol or drugs which can cloud judgment and increase risky behaviors, and attending large indoor gatherings with people from outside of your household. Therefore, as you prepare to celebrate and give thanks during the holidays, remember giving thanks is good for you and consider low risk activities. Thank you, and I look forward to connecting with you during our next webinar. Take care. Have a good day.